My name is Ira Dehimi. I'm the founder and CEO of Selfa Incorporated. We are a medical device company with technology licensed from the University of California here at UCLA. Selfa can bring a transformational impact to the detection and treatment of CML and is beneficially applicable to other cancers and infectious diseases. We can bring the cost down from $130 to $5 without sacrificing sensitivity. We are seeking bridge financing of $300K to $500K in the form of a convertible note at a 20% discount at conversion, while simultaneously seeking a $3.5 million A round. We at Selfa are privileged to count as our medical advisor, Dr. Robert Gale, sitting here with me. Dr. Gale, could you give us a brief background?
Yes, so I'm a physician and a scientist. My training has been mostly at the University of California, UCLA. I'm currently a visiting professor of hematology at the Imperial College in London, and I'm on the medical staff at UCLA. My MD focus is really on cancers of the blood and in transplantation and treatment of cancers. My PhDs are in immunology and in molecular biology. There must be tens of thousands of patients with chronic myeloid leukemia who are never tested, who are never treated. These people are dying unnecessarily. And so, again, the availability of a highly sensitive and specific, readily available and economically viable test in CML would be a great advance. Of course, it could be a proof of principle for other diseases that are equally important, infectious diseases, other forms of cancer. But probably the the example that everyone uses when they talk about the targeted therapy of human cancers is chronic myeloid leukemia. So this is a brilliant place to start and see if you can do better than we currently do.
My name is Kaveh Shuride. I am one of Selfa's co-founders and I serve as its Director of Technology. I got my PhD in the Electrical Engineering Department right here at UCLA, and my research was on a new class of semiconductor devices called nanowire biosensors. These devices have the capability to deliver what CML patients need in their testing, which is why we formed Selfa and we're bringing this technology to market.
I am Shabna Mohandisi, Director of Assay Development and co-founder at Selfa. At Selfa, I develop novel tests for CML patients under chemotherapy drug treatment. CML is a kind of blood cancer that is curable. There are a lot of chemo drugs already in the market, but the problem is that doctors need to monitor patients for the effectiveness of the drug constantly. So the current technologies in the market are limited to PCR-based techniques, which requires optics, fluorescent molecules. They are costly. They are not accessible everywhere. They are limited to hospitals and labs. But what Selfa is offering is a portable handheld device that doesn't need any optics or fluorescent molecule. It can be accessible everywhere at doctors' offices, even at homes, and it has higher sensitivity and with lower cost. So Selfa is offering a novel test for CML patients, and it can reduce the 3-month monitoring to even a weekly monitoring. So in this way, doctors can prevent from the cancer reoccurrence and patients' life will be saved.
By relying on nanowire biosensor technology, Selfa can avoid using PCR and labeling techniques. Not using those techniques means the process is much simpler and therefore lower cost.
What I'm hoping for is that we could compare Selfa's technology, which seems to be highly sensitive and specific, to our current techniques, which are good, but as I said, they're imperfect. And we'd like to see if the Selfa technology can give us a leg up on what we currently do.
Please invest in us and help us bring this technology to all CML patients in the world. Thank you.